Mayor Rahm Emanuel is saying to the good citizens of Chicago, if you want, or not to the good citizens, the good employees, the city workers, city employees, you're going to have to take a fitness test, and if you are overweight, since obesity is a big problem, if you're not in physical shape or in good shape, you have a choice. You can either sign up for a fitness program and get fit, or you can pay an extra $50 a month. Fraternal Order of Police says their members, the union for the police officers, says, we have different health concerns, like being shot at, and we don't want our members to pay higher premiums if they decide not to enroll in this exercise program or whatever it is. So which way should that come out? This is an interesting one because there's a lot of different ways you could look at this. Seton Motley is with us, the president of Less Government. His Twitter is @Seton Motley, SetonMotley, and @LessGovCC4. And his photo on our plasma, those of you watching, is you were a model, Seton, some years ago?
Yes. When I was a musician, and I got some gigs modeling, and that led to 5 movies I was in, and so yeah.
Holy cow! We got a rock star on here with us.
Okay. Back on the day.
So Seton, the response, the take that I have of yours on this is doesn't seem to make sense.
Well, first of all, if you don't like it, go work for someone else. Second of all,
right.
Of all the municipal workers to complain about this, the cops who have to run down criminals are the ones that have come out in opposition to this.
Well,
really? Really? That's the classic joke.
Okay, so you're defending this program. You're defending this program. You're defending Rahm Emanuel, saying, "Hey, you got to go to the exercise classes or pay the $50."
As an employer, yes, I'm defending his right as an employer. Yes.
Okay, and I'm saying, how do you know that this program is the program that's going to get people fit? I mean, I'm a vegan. I mean, I think, frankly, that does a whole lot more for somebody than being than working out, than pumping up or dancing with a bunch of people in the mornings.
Look, then go. Look, if you don't like it, go work for someone else. The employer has the right to do what he wants.
Okay, so you're saying the city of Chicago has the right to mandate this $50 a month thing?
Well, you cost more if you're out of shape anyway.
So do you think that the health insurance companies in America should be right now? Typically, if you have a group, most people are members of groups. If you have a group policy, the same price for everybody. Do you think that health insurance
it should not be the same price for everybody?
Companies should have the right to say, okay, Seton, you've got high blood pressure, so you're going to cost an extra $300 a month.
Yes, absolutely.
And
we do it everywhere else.
Okay.
If I use $500 worth of bandwidth instead of $50, the internet company has the right to charge me more for using more bandwidth.
Well, let's look at the law of unintended consequences here, because we're not talking about bandwidth here. We're talking about human lives, and we're talking about human health. If people look at this and they go, $50 a month is a lot of money, and I'm not going to pay that, and go along with the program, and they end up uninsured.
Well, that's their own damn fault.
And then it costs us all when they have a heart attack and they're not insured and they show up in the ER.
Zero sympathy for self-inflicted wounds, man.
No, it costs you and me when they show up in the ER because they didn't go along with the program.
Well, then they should be forced to pay it back once they show up. So
you're in favor of government mandates?
No, I'm in favor of people paying their bills. The government forces all kinds of debtors be forced to pay back their debts.
So you're saying that if somebody is living an unhealthy lifestyle, their insurer should charge them more.
Absolutely.
Even if that causes them to get more unhealthy.
It doesn't cause them to do anything.
And cost the rest of society even more.
There are adults that make adult decisions. No one forces them to do anything. Put the fork down and slowly back away. That's their choice, whether they do that or not.
Don't you think, though, that there is a reasonable argument to be made that these decisions should be made? And I'm not frankly, I'm very ambivalent about this. I could argue either side of this, but the Mayor Rahm Emanuel is saying, okay, this program by this $50 a month, this is going to save the city $500 million in their health care bill because fewer people are going to be sick. Now, that supports your position that city workers should be forced to pay the extra $50.
I'm not predicting that. What I'm saying is the insurance business is a game of actuarial tables. And they can
I'm not talking about the insurance business. I'm talking about public health. The public health business.
About public health. I care about my health and my family's health.
Well, you're part of the public seat, and if the guy sitting next to you,
it doesn't mean I have to pay for them.
If the guy sitting next to you has TB, or the guy driving down the street who has a heart attack while he's driving and runs into you and injures you because he wasn't taking good care of himself, then all of a sudden the public health is your issue.
Yes, but does he have insurance?
Well, if he's already run into you, do you give a damn?
If he runs into me, does he have Geico? Does he have State Farm?
Do you care? I mean, wouldn't you rather not be run into? Wouldn't you rather not get tuberculosis from a guy sitting next to you? The fastest guy. There's this week we hit 7 billion people on planet Earth. 1 billion of them have tuberculosis right now. Do you really want that guy sitting next to you because we don't have health insurance available to us?
Then look. If he's going to be a deadbeat, he's going to be forced to pay for being a deadbeat.
Why not just have the city pay for everybody's health insurance as part of it?
Because it doesn't work. Because then you end up standing in line for 8 months to get a checkup.
But the city is paying for everybody's health insurance who works for the city.
No, they're not. Just the employees, and they're charging more for people.
Well, that's what I just said. For the people who work for the city.
Yeah, and if they work for the city, and the insurance runs the actuarial tables and says Cop A is going to cost more than Cop B, then charge Cop A more.
So if somebody,
very simple.
What if somebody has a genetic condition? What if they're genetically more inclined to have heart disease? They should pay more?
Pay more, too.
Yeah, because they're not a member of the Lucky Sperm Club. They're a member of the Unlucky Sperm Club.
No one's a member of the Lucky Sperm Club.
I would say if you're white in America, you're member 1. If you're born into a rich family, you're member 1 and 2.
There isn't the Lucky Sperm Club. There's a bunch of Lucky Sperm Clubs. Everybody's got advantages. Everybody's got disadvantages. Life isn't fair. The moment the sooner government officials and leftists realize it and stop trying to legislate it, the better off we all will be. Life ain't fair.
So the people who are born with a genetic predisposition, we know, for example, African Americans are more inclined toward certain types of cancers and heart disease. They should pay more for insurance because they're African American? Absolutely.
No question at all. None. Zero.
Okay. This is blowing my mind. I don't see how, if you want to live in a society that works, you could go down that road. But I do.
It works better when everybody pays for themselves.
But I do understand your logic. Seton Motley. At Seton Motley. Thank you, Seton.